In health news today, rural hospital closures are making it harder for Americans to access care, and now new research is shedding light on another consequence of those closures. Here to share more, we're joined by Caitlyn Carroll, an assistant professor in the School of Public Health at the University of Minnesota. Professor Carroll, thank you for being here. You are the lead author of this new research piece that was published online. And from what I read from it, not only are rural hospital closures leading to worse access for patients in those communities, but also higher prices when they go to other nearby hospitals. So for our viewers out there, can you elaborate on exactly what you found?
Yeah, that's right. Thanks for having me. So the goal of our paper is to try to help understand the effects of rural hospital closure. Like you said, we know from existing work that when rural hospitals close, it decreases access to care and can lead to adverse health effects for patients who have time-sensitive health conditions. In this paper, we look at something a little bit different, which is the effect of rural hospital closure on commercial prices. Now, these are the prices that hospitals charge when they treat patients who have private health insurance that they get through their employer. The basic motivation here is that because these commercial prices are negotiated between hospitals and insurance companies, hospital closure might actually give surviving hospitals increased leverage to negotiate higher prices. So in this paper, we look at the effect of rural hospital closure on the commercial prices charged by nearby hospitals.
And then obviously a lot of eye-opening information in that study. What surprised you the most when you looked at all these numbers after all this research?
Yeah, we have two findings that we think are pretty notable. Our first finding is that when rural hospitals close, surviving hospitals that are nearby do in fact increase their prices. We estimate about a 3.5% increase in prices, which is consistent with increased market power and increased negotiating leverage for these surviving hospitals. Our second finding is that before these hospitals closed, they were actually charging lower prices than the nearby surviving hospitals. And this is important because it means that hospital closure can move patients into higher price hospitals and eliminate a low price hospital from the market.
Assistant Professor Caitlyn Carroll with the University of Minnesota. Professor Carroll, appreciate you taking the time to share this information with me as well as our viewers today here on First Alert at 4.
Thanks for having me.